Hello, this is Dr. Pelto, and welcome to Healthy Living. As school gets back into session this time of the year, so do many fall sports. And some of these sports include football, cross country, and soccer. However, many athletes and their parents don't realize that these three types of shoes, which are cleats, can lack cushion. So here's an example of a different type of a cleat that can be used in soccer, in football, and also for racing. You can see the same thing that's common in the cleat or a shoe without much cushion that's quite form-fitting to the foot. This type of shoe, in conjunction with the pounding and impact, can cause heel pain in the heel in many children around the ages of 8 to 14 years of age. The technical name for this problem is called heel pain in children, or Calcaneal apophysitis, or it's also called Sever's disease. Although it's not true disease, it's the most common cause of heel pain in children. And it can happen in one or in both feet. So calcaneal apophysitis, or this inflammation of the growth plate in the heel, it typically affects children because the heel bone, called the calcaneus, isn't fully developed until the age of 14. So let me show you here. This is an example of a heel bone, and the growth plate would be right about here. And until the age of 14, this growth plate is open and it's forming, and this is called a physis. That's a weak area in the back of the heel, and that's why we call the problem calcaneal, which is the heel bone, apophysitis, which is an inflammation of this growth plate at the back of the heel. That's caused by too much repetitive stress on the growth plate. Heel pain in children differs from the common problem that adults feel called plantar fasciitis. While heel pain in adults usually subsides after a period of walking, the pediatric or the child heel pain doesn't usually improve that way. In fact, walking, jumping, and impact sports can typically make the pain worse. So what's the cause of pediatric heel pain or Sever's disease? Overuse and stress in the heel through the bone, participation in major sports, is causing this inflammation of the growth plate. The heel's growth plate is sensitive to repetitive running and pounding on hard surfaces, and this results in muscle strain and inflammation of the tissue. For this reason, children and adolescents involved in soccer, track, basketball, and are especially vulnerable. Other potential causes of calcaneal apophysitis include obesity, a tight Achilles tendon, and biomechanical problems such as flat foot or high arched foot. What symptoms does a child have when they have this problem? Typically, the symptoms for calcaneal apophysitis include pain in the back or the bottom of the heel. So let me show you. In the back of the heel right here, or on the sides especially, is where they're going to have pain. And what's this going to cause? This is going to cause limping for the child. It's going to cause them to walk on their toes. It's going to cause them difficulty running and jumping and participating in the usual activities that they're used to. And it's going to cause pain, especially, like I showed, when you squeeze the side of the heel. They're going to be tired as well. So how can you diagnose this problem? To diagnose calcaneal apophysitis, or a children's heel pain, you need to rule out a more serious condition, such as a break or a fracture in the back of the heel, or a tumor in the bone that can also have similar symptoms. And this is done through making a medical history and physical and asking questions about recent activities. A foot examination is typically done, as well as x-rays. And usually an x-ray is the most important aspect for making this diagnosis. If you do an x-ray and you see that line, you're going to be able to determine that the child has calcaneal apophysitis. Occasionally, you can need some other imaging, like an MRI or a CAT scan or some laboratory tests, if they're indicated. So usually the line will be seen in the x-ray at the back of the heel, like we showed right here. This is right at the growth plate, and it's quite commonly the place where you squeeze the bone, there's going to be pain. So what is the treatment for this condition? This really is patient dependent. But most of the patients, we recommend that you reduce the activity of your child. They need to reduce or stop it, especially those activities that cause pain, such as jumping and running. So support the heel. Temporary shoe inserts and cushions or custom orthotics may provide support for the heel. So here's an example of a cushion. This is just a silicone cushion that can go in the back of the heel in the shoe, and it's going to give it a little bit more cushion from that impact. Something similar is an orthotic that has a nice arch support in it, and this is going to take some of the pressure off the heel and put it into the arch of the orthotic. You can also take anti-inflammatory medications such as Motrin or ibuprofen to help reduce the pain and inflammation in the back of the heel. Many times we use physical therapy as well. This can be used to help with stretching and loosening up the deep tissues in the back of the calf, along with other modalities that can be used to promote healing and reduction of the inflammation in the tissue back there. Immobilization. Some children that have severe pediatric heel pain need to be placed in a cast to help promote the healing and help rest the foot and ankle. They need to have it immobilized. Often heel pain in the child returns even after it's been treated initially, because the heel bone, you have to remember, isn't done growing till the age of about 14. Recurrence of heel pain may be a sign of calcaneal apophysitis or another problem. If your child has repeat bouts of heel pain, be sure to make an appointment with your foot and ankle doctor. Can calcaneal apophysitis be prevented? The chances of a child developing heel pain can be reduced by choosing a well-constructed, supportive shoe that's going to be appropriate for their activity. Avoiding and limiting wearing cleated athletic shoes, so shoes that have cleats that don't have support, and then avoiding activity beyond your child's ability. If you'd like to learn more about pediatric heel pain or calcaneal apophysitis, go to drpelto.com and you're going to find a link titled Healthy Living, and you can get more information there.